Hi, and welcome to Orange County Chiropractic Car Injury Clinics. And let me share with you how we help relieve headaches and headache-related pain due to major trauma or minor trauma. And what happens is when typically we have headaches, and there's different types of headaches, but most of the most common headaches we see are due to what's either called major trauma or minor trauma. Major trauma is like auto accident, injuries, falls, things like that. Minor trauma is something you do every day, and then eventually it just kind of wears on you and breaks down and starts causing problems. So let me share with you how we can help headaches specifically. What happens is when we look at the headaches, we're going to evaluate the headaches, and we're going to take through a specific test to do an analysis to see exactly what the problem is. So number one, we'll do a consultation for the headaches, and that'll give us an idea of the origin of the headaches, when it started, things of that nature. And then we're going to go through some very specific tests that are going to tell us what part of the anatomy is involved, what part is not involved, so we can get very specific with exactly what to treat and what therapy to use. So let me just share with you, and this is actually part of our new patient special. So it comes with, number one, the private consultation. Number two is we will do what's called range of motion testing. So we'll see actually how the head is moving to see if it's moving normal or abnormal due to these major or minor traumas. And that's real important because we will often find restrictions, whether it's bending forward, backward, left, or to the right, especially turning. We commonly see restrictions in turning that are directly related to headaches and the joint pain. So what happens when we check the range of motion? It tells us what areas are restricted or not restricted. That tells us specifically where to use the therapy and what therapy to use. As an example, when we see restrictions turning to the right, we know that there's some joint malposition and there's some dysfunction in the joints getting the head to turn to the right. And that is often what causes nerve pressure, joint pressure, muscular tension, just a whole complex that creates the headaches. And we typically, when we restore that, the headaches are almost immediately, you feel better immediately. That's what happens. So that's the importance of the range of motion test. Then we'll do muscle testing. We'll test the muscles and the neck and head and see what's involved. We're looking for not only muscle pain, but muscle weakness to see what's involved so we know what muscles to work with and what therapies to use. Because again, there's some therapies that we use that are specifically for muscle, some therapies that are specifically for range of motion, some therapies that are specifically for nerve. You see, so it's real important to know what part of the anatomy is involved first. That's why the examination process is so important before you apply the actual therapy. So we'll check range of motion, we'll check the joints, we'll check muscle strength, we'll check the nerves. We'll look at the nerves going to back up the head, up to the side. We'll check the cranial nerves to see which ones are involved, which ones may be more sensitive or less sensitive, so we know exactly which nerve's involved. And if a nerve's involved, we'll know what type of nerve therapy to use, what type of therapy that specifically relates to treating nerves. You see how that works? Next thing we'll do is we'll do orthopedic joint tests. And the example that I shared with you is a very common example. We'll see if any of the joints in the neck are what are called fixated or stuck or not moving properly, because that's a very, very common cause of headaches, to be honest with you. We see that a lot. And the good news is it can be helped pretty fast, pretty quick. Usually we get good relief fast with our therapies. So we'll check to see if any joint dysfunction. And then we'll also we'll typically take at least a couple x-rays to see what the neck looks like. And the x-rays help us to see on the inside what we can't see on the outside. So that's real important to do that. And a lot of times I'll share with you that's often missed by other doctors is we not only will take what's called stationary x-rays, we do standing still. Those are kind of important, but what's more important are what are called motion x-rays. We have you bend forward, take the picture, and we have you bend backwards. Because we can see how the bones are moving, and we can see if they're moving, the bones in your neck, we can see if they're actually moving normal or abnormal. And we already know if they're moving abnormal, we already know that's a problem. That's going to cause pain, muscle restrictions, But the most common cause is pain, headaches, muscle tension. Those are the most common causes when the spine doesn't move normally, when those bones don't move more normally, bending forward or backward. Similar is the example I just shared with you when you turn to the right or to the left, see? So that's what's evaluated with those, what we call the motion x-rays. And then, so now we're going to know if we can help you, if you have a problem that chiropractic can help you with. And their chances are, most of the time when people have headaches, they are physical medicine problems. They're not from organic disease. They're typically biomechanical, structural, physical medicine problems. So if that's the case, then the new patient special, we offer, it includes 3 chiropractic treatments to see how quickly we can get you to start feeling better. Typically with headaches, we have really good results with headaches. Typically on the very first adjustment, you feel better immediately, to be honest with you. And then it includes 3 pain relief muscle spasm therapies. Usually with the headaches, you also typically have some muscle tension, muscle spasm. Usually there's a muscle component in there also that's associated with pain. So we have therapies to help decrease the muscle tension and spasms with that. So that's what it includes. And it does come with a guarantee. We have a 2-part guarantee that when you come in, that it's a 72-hour right to rescind. In other words, if you're not 100% satisfied, you get 100% of your money back. And number 2 of the guarantee is we have what's called a no-wait policy, or what's called a 7-minute wait policy. And what that is when you come in on your scheduled appointment, you'll see the doctor within 7 minutes of your scheduled appointment, which is very unusual. So in other words, when you come in our office, it is not going to take 2 hours. It's not going to take a half a day. You are not even going to have to take off from work. We'll be able to get you in and get you out within about 20 or 30 minutes. And you will not wait more than 7 minutes when you come in with your scheduled appointments. In other words, we're going to respect our patients' time. So that's the second part of the guarantee. So that's the new patient special to help to not only to see the cause of the headaches, to see specifically what specific anatomy is potentially causing the headaches. That becomes very important because that helps to determine the therapy. Very important. And then if we feel chiropractic and chiropractic therapy can help, that includes 3 chiropractic adjustments with 3 therapies to help relieve pain and muscle spasms. Now, all of that typically costs $350. The new patient special, when you call in, ask for the new patient special, it's only $97. $97. It includes all that. Now, if you've been in an auto accident, your insurance will cover 100% of it. 100% of it. And by the way, we do accept Medicare. We do accept all insurance policies. We accept them all. And if you don't have insurance, it's no problem. Use our new patient special anyway. So we're here to help you. So that's exactly how we evaluate you. We find out the cause of the problem, what anatomy is involved, and then depending on what anatomy is involved in the cause of the problem, that's the therapy we use to help correct it as fast as possible to get you to feel better so you can not only have decreased headache pain, muscle spasms, and restrictions, but essentially where you can work. You can live your life. You can go to work without headaches. You can sleep, bathing, showering, getting dressed. In other words, live your life. Enjoy your kids, do cooking, cleaning, laundry, etc. like that. In other words, enjoy your life without living with headaches. So that's what we do. And we have a lot of patients come in with headaches. We have a tremendous amount of success with helping relieving headache pain. So give us a call. Just ask for the new patient special. Again, we're Orange County Chiropractic Car Injury Clinics right here in Santa Ana, California. And you can give us a call at 714-617-5858. Again, that's 714-617-5858. When you call, there's a good chance we'll be able to get you in that very same day. Remember, it's only going to take about 20 to 30 minutes. You're not going to come in our office and spend 2 or 3 hours. So you literally can come in before work, at lunch, or after work. You'll be in our office for about 20 to 30 minutes. We'll get you right in. You won't wait. You will not wait more than 7 minutes to see the doctor. and it's 100% guaranteed or 100% refundable after 72 hours within 72 hours if you're not satisfied, okay? So we look forward to helping you. Give us a call. Again, we're Orange County Chiropractic Car Injury Clinics. Give us a call at 714-617-5858. We look forward to helping you.